And here we are on the couch with Sanjeewa from MedTech. Welcome.
Thank you.
So, a busy time for you at a conference like this?
Yes, absolutely. It's a great privilege to be platinum sponsors and support this event.
Yes, I know that the NZMA are very grateful for that as well.
Sure.
The things that you're talking about here today, I noticed that ManageMyHealth is a big part of the promotion here.
Absolutely.
Tell us more about that.
Yes, it's a very exciting year this year. As you know, ManageMyHealth patient portal was originally launched in 2008. And with the advancements of the mobile apps and the app stores globally, we have released the ManageMyHealth patient portal now in the Apple App Store and also in the Android Google App Store. So that's really exciting for us. Mm-hmm. So which means patients, doctors, nurses, anyone who's using ManageMyHealth today will be able to download those apps and do various functionalities they do today to the website through their apps.
Right. So nice and easy. So if you're a congestive heart failure patient and you're taking your weight or blood pressure, very easy just to update.
Absolutely. So you can update your various vital signs.
Yes.
At the same time, you can book appointments, you can order for your repeat refills for your medication, you can get your lab results come to you, you can have an email consultation with your doctor, and also you can get reminded of various other important health events. So it could be like your flu vaccinations coming up and all kinds of things.
Yes. Okay, that's fantastic. Now, the other thing that I've noticed is this new term, evolution.
Absolutely.
So what is evolution in MedTech terms?
So in MedTech terms, as you know, MedTech 32 has been around for quite a long time. MedTech Evolution is the new generation product. It's quite exciting for us. Basically, it's built a brand new developed product on Microsoft's .NET platform. It's got a brand new user interface, which is exactly using the Microsoft Common User Interface. So what that means is that anyone who's used Microsoft Office, use Microsoft Office Excel or Outlook kind of programs can basically use Evolution in about 15 minutes of orientation.
So what advantages for general practitioners then? What are the new features in it?
So first of all, I think the productivity in terms of the usability is the major advancement. You'll find that a lot of things you do in MedTech 32, you'll be able to do in half the time in Evolution. Mm-hmm. But not only that, Evolution is a very intelligent platform. It's got what's called a clinical and business intelligence tool built onto it. So which means that rather than you having to remember to do things, the tool will actually prompt you and remind you to do things. Mm-hmm. So you can keep track of all your health targets, various other clinical and business indicators. That's really important for your practice. Mm-hmm. So you need to get the software to do all the work and take a little bit of a break.
So the process to upgrade is easy?
Absolutely. So we've tried to make it as seamless as possible. In terms of the training side, like I said, because it's a Microsoft user interface, everybody's familiar with it. We find that after a 15-minute tutorial, anyone can navigate it. It's got a very easy, seamless workflow. And in terms of the data migration, if you're coming from MedTech 32, we have perfected a data migration framework where it means you can actually move that very easily.
So in theory, on a Friday, you could be on 32, and
on a Monday, you're on Evolution. Okay. Absolutely.
Yeah, okay, great. That's very good.
Yeah.
So the other thing I've noticed is you've been talking about beating the blues, which is very topical at the moment.
Yes.
Very, very topical indeed. So what's MedTech's involvement with that?
Sure. I mean, we are very, very committed to trying to uplift the performance of mental health in general. And back in 2010, we were awarded a contract by the Ministry of Health to offer the national e-therapy service using a product called Beating the Blues, which is actually from the UK, which is endorsed by the National Institute of Clinical Excellence, and it's offered widely in the NHS and what have you. So we've been offering that program in New Zealand, and it's currently been offered through many general practices and also in the community through primary mental health practitioners. So we're trying to raise the awareness of that program, its success, in terms of the uptake and the clinical efficacy comes with it. Mm-hmm. So as you know, we all face a lot of challenges at the moment in the country around mental health, and this is a tool for patients with mild to moderate anxiety and depression. So we think this is a really good tool where people can benefit from it quite immediately.
So how does it work? So the patient logs in?
Yeah, so you go to your GP and the GP will have or your nurse will have a conversation with you and says, look, do you want to try out this program? The program is actually 8 sessions of 50 minutes each. Doesn't mean you have to do it in 8 weeks. You can do it in your own pace, in your own time. So that gives people comfort of their own home and the convenience. And it's 50 minutes, but you can take 1.5 hours if you want to. There's nothing wrong. So basically you go through, and the program is based on what we call cognitive behavioral therapy, or CBT. So it's pretty much evidence-based program, and people do the program in their own convenience, and we'll take them through various exercises to help understand their feelings and thoughts and what have you.
So a self-help, but tools to cope?
Absolutely. It's more than self-help. It's actually a clinical treatment.
Okay.
So, it's a substitution to, say, medication or face-to-face counselor referral. So people can go through Beating the Blues, and basically, they can overcome their depression and anxiety symptoms if they are mild to moderate classed.
Sanjeewa, a busy time for you. Thank you very much for your time today.
Thank you. It's really exciting to talk about all these great developments.
Great. Okay. We'll back to you soon.
Thank you.